welcome to the latest episode of Surgeons' Lives. I'm your host, John Monson. My guest today is Sherry Wren, who is a professor of surgery at Stanford Health and has been the secretary of the American College of Surgeons since 2022. Sherry is a GI surgeon, but is perhaps most passionate about the concepts of humanitarian and global surgery, having worked delivering healthcare and, more importantly, delivering the capacity for healthcare in several areas of significant danger and conflict around the world. In this conversation today, which I have to say is a fascinating discussion, she covers all of this intellectual and work-based activity, as well as her passions for science fiction and going on diving boats in Indonesia. Please don't forget to like and subscribe to the channel. Send us your comments, and I hope you enjoy the conversation with Sherry Wren. I'm John Monson, and this is Surgeons' Lives. So thanks very much for spending some of your afternoon to join the latest episode of Surgeons' Lives, which, as you know, has a secondary line that says stuff that matters. So although we normally spend a few minutes, and we will with you, obviously, talking about the glory of a surgical career, it's some of the other stuff that I like talking about as well. I've always wanted to show that there's life beyond the CV.
Oh yeah.
So, but for everyone's purpose, and for the tiny few people that don't know Sherry Wren, etc., maybe you'd start by giving us a little bit of early life and background, starting with I was born in.
I was born in the south side of Chicago, believe it or not. And I am the only college grad in my family. And my brothers are all in the trades. My dad was in the trades. And I decided that I loved school and wanted to be a doctor, and went off to a small school in Minnesota. Then went to medical school and fell in love with surgery. I don't know, did you ever know Jack Pickleman?
No.
Jack Pickleman was sort of a legendary surgeon in Chicago.
Okay.
And for some people, I would say legendary good, and for others, they would say legendary bad. Jack used to give the how not to give a oral board exam. He had this famous video. And to me, Jack unfortunately passed about a year ago. He just was one of those individuals who inspired you to want to be the best that you could be, to learn the most. And at a time when I'd never seen a woman surgeon, when I went, there was none, and really encouraged me. He's the person who told me to leave Chicago and go to the Ivy League for my training and do all those things. And that's how I got started.
Why do you think he told you that?
I don't, it's funny. I had never thought I would have left Chicago, right? I mean, you obviously left not even just where you grew up, but in a country, and came to another place. I had always sort of thought, that you would stay in Chicago, and, you would, it's funny. And I think that he thought that the training, I had done 2 summers at the NIH, as a medical student. I think he thought that the academic surgery, I wanted to do academic surgery, and that's what he recommended. And I was like, okay, I'll listen to this advice from somebody I really admire.
And just before we move on past him, as you said, I mentioned earlier, he was I think the term is a multifaceted character, but maybe you might refer to it as a polarizing character. You obviously found him inspiring and admired him. What was it about him that made the other people take the opposing view?
Biting, sarcastic wit.
Nothing wrong with that.
Nothing wrong with that. And I would say a lack of tolerance of stupidity, of, um, we all get sorely tested sometimes. And I would say I've spent my career learning how to calm some of my inner, I'd really like to punch somebody, tendencies. And Jack did not suffer fools well.
Yeah, yeah. But you just pointed out that you've spent many years trying to curb your inner Jack, if you like, etc. Do you think that's because? Do you think he should have done that too? I mean, would he have been a better person, or are we too? I don't know what the term is. Sometimes people use snowflake as a term, but I don't really want to get into that sort of debate. But
Yeah, it's funny. I'm not going to talk about Jack. I'm going to talk about,
yeah,
coming up on many years in the career.
yeah,
I would say that there was absolutely inappropriate behaviors that happened, right? That should never have been there. Throwing things,
yeah,
hitting people.
yeah.
That's not, it was never appropriate. It was highly tolerated. So I'm glad that we have evolved away from those issues. I'm also, though, get frustrated that there's an assumption that everybody should be doing their job and, running a division, running those things. And even with myself, if you're with a team that's not doing their job and, and you eventually sort of lose it, why are you always the bad guy? And nobody's looking at the fact that, I mean, we've all heard it. My favorite phrase on the face of the planet is, we don't have that doctor. And it's like, come on, we do our operations. It's not like we do them differently every single time. And, that type of and what I dislike is that the system allows for many people to not do their job, and we're the bad people when we sort of lose it because of those things.
Lost count of the number of surgeons, either on this podcast or outside of this podcast, that have remarked that systems seem to specialize in stressing the surgeons through systems like that, through pieces like that, as you say, either staff or equipment or turnaround times or whatever it might be, and then without exception turn around and blame the surgeon when they finally crack, if you like, and do something that is, yes, genuinely not appropriate, etc. But it starts with the stress in the system, and
Well, it's that thousand cut thing, right? Don't you hate going in the OR and starting your day stressed? I mean, nobody wants to start their day pissed off.
yeah,
And, you do all these things. Like, I literally call the OR and be like, okay, I want to make sure that we have these instruments, these items, whatever it is. And then you get there and they're not, it's sort of like, okay, why do I, and you're trying to, yeah. So as I said, I,
what
I, uh, I go, when I can't help myself, I go snarky.
was one of the earliest interviews I did was
with a surgeon called Bobby Mukamala, who's quite senior now in the AMA and various things. He's an ENT surgeon, private practice in Michigan. Been there forever. And he single-handed private practice. So not that.
Wow. Those are the old days, right?
Except he's not. He's not ancient. He's just an interesting high achiever. And he said to me, "Yeah, I go in the morning, and I go in at 6:30, and my case starts at 7:30, and by 12:30 I've done 8 cases, and then by 1 o'clock I'm in my office."
Wow.
I said, by like 9:30, we're wondering where the anesthesia people are. And as he says, there's no stress in his life. He works with the same anesthesia person, blah 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 blah, and the rest of us are going like, who hasn't turned up today or whatever.
Or you walk in the room and you're just like, I know, like for a Whipple or something, I'm never going to get started.
Sure.
And it'd be a miracle if, cut time, it's an hour minimum. And I've learned I just have to stay in my office. They know I'm there. They've seen me. I've checked my patient in. But if I go, it's the only way I can keep my stress down. I cannot be in that room. I just accept the fact that I can go to my office, get some work done. And I'm just not going to start until 9 o'clock, 9:30. And that's just the way it is. And I'm not going to stress, because if I have to be in that room, it's like you feel your blood pressure going up. You feel, and it's just, yeah. We all make these little adjustments.
Oh, for sure. Well, we should move on from, we've done our
the fun stuff.
We've moved on to our venting. So you came from a non-medical background, as you say. Did your medical school, went into medical school. So outside of the wonderful Dr. Pickham, who were your mentors around that time? Who guided you in terms of creating a surgical career at a time that, as you say, when there may well have been women surgeons, but they weren't particularly visible.
I went to Yale, and at Yale there was a very master surgeon, Elton Cahow, C. Elton Cahow. He was like he was just this old, he's from Florida, he was like a gentleman surgeon who just was so good at what he did. And I don't, it's weird. I have to say, I have not necessarily had a huge amount of mentors until I kind of hit my fellowship.
Right.
So I left Yale to go do research. I went to Pittsburgh because the person I'd worked with at the NIH was at Pittsburgh. I thought I was going for 2 years. I fully intended to go back to Yale to finish my training. I loved the training at Yale. Then I ended up spending 3 years in the lab. Pittsburgh was like this incredible place for academic surgery then. They asked me to stay on and finish my chief years. If somebody had told me that I was going to spend 5 years of my life in Pittsburgh, that was never in the plan, and the plans kind of change. And I really fell in love with HPB. I did all this transplant research, but then I decided I really wanted to be a HPB surgeon as opposed to a transplant surgeon. And there was a very bad experience that sort of happened in there. I kind of look at, you go through life and you kind of get knocked in the jaw sometimes in your life. And that was one of the times I got really knocked in the jaw, but it gave me a chance to think about what it was that I wanted, as opposed to being on this path that you get on this path, especially back then in academics. It's like, I called it mini-me mentoring. I'm really, I like what I do. I think you're great. You need to have your career look just like mine. And not actually ever really sort of saying, hey, what's important to you about your career? It really, the observations from those years in mentorship have really changed how I approach mentorship, which is the most important thing is how do you become honest with yourself about what it is you want and don't want? And so after this negative experience, I had that chance to relook at, and I decided I wasn't going to be a transplant surgeon and went to LA and met an entirely different group of people who approach things in a really different way and sort of had the first, in many ways, professional mentorship I'd had after this medical school experience.
You separate or distinguish, it sounds as though you were distinguishing as in what you described mentorship versus sponsorship. The concept of the mini me is really to some extent more of a sponsorship.
Now, I view sponsorship as a positive thing,
Okay.
especially as a woman. So I would not, if I had not had male colleagues who put my name in at the right time and the right place and the right societies, to me, that's sponsorship.
Right.
So I don't view sponsorship in a negative light. I actually viewed it as a very positive light that I had this cadre of people who really sponsored me and helped me in an academic career. I think the mini-me mentoring, I think people are thinking that they're actually mentoring. I don't think, I think they really believe that they're being great mentors.
But it can blend into the other, can't it? I mean, the sponsorship can be basically asking, somebody to carry my brand forward. Yes, I'll put you forward,
Yeah.
but really it's a transaction. And that's, I mean, a lot of stuff in life is transactional, of course, to some extent. But one way or another, though, you managed to navigate that, and I'm guessing at this stage of your career, you still had the thought about maybe being the chair.
Oh, yeah.
Yeah.
Yeah, I mean, I was driven about the chair thing because again, when you looked at what was success, right? Success was, you were going to go, you were going to be the triple threat, you're going to be a great clinician, a great educator, a great researcher, you're going to run a division, you were going to do all those things, and eventually you were going to be the chair. And I think again, the chairs that I knew, I would have loved having the job of the chairs that I had seen, because this is pre the world being everything about business. This was when the chair really was sort of the academic head, was, you know, I guess, money must have been good that they weren't worrying about it as much, and you could kind of concentrate on, hopefully developing your faculty and, all those things. It wasn't about, it wasn't what I view being a chair is now. So if you could turn the clock back when a chair was at least the things that I perceived were the chair, I would have done that job. I didn't want to do the job of a current chair.
When did you decide that, or decide or realize one or the other, that, this is not for me?
It was when we met. It was actually very interesting because, you go out, you do these interviews at all these chair jobs. I was really great at being candidate number 2. I excelled at it. Or in my dark moments, the always a bridesmaid, never a bride,
Yeah.
kind of mentality. I don't know what guys say, but
Isn't,
that's like
isn't everything number 2?
yeah, yeah, I mean, it's like always a bridesmaid, never a bride. And And I'll be honest, I think sometimes a lot of that is ego. I mean, I'm phenomenally competitive. I'm phenomenally self-competitive, all those kinds of things. And, and if you had said, why do you want to be a chair and all those things, you want to know why I had wanted to be a chair? What really attracted me to that institution is that they had 1.5 million covered lives that they had. And I wanted to run, this is going to sound insane. My idea was, oh, this would be so cool. I think we need to look at how do we deliver surgery to a population in like an equitable way and look at it in a very different way than I see this world is going. Well, guess what? That's not the job of a chair. And, what was the first job of that chair? It was to go hire a chief of cardiothoracic surgery, right? And so, you're looking at, and I'll never forget getting the phone call to being told I was number 2 again. And that I can even remember where I was standing. And that first, like, just pissed offness, like, I was a bridesmaid, never a bride. And then pretty rapidly realizing that, you know what? If I'm really honest with myself, this is not the job that I want to do. And another thing is I also kind of thought about it. I work really hard, and all of us do. But in some ways, I didn't want to work harder at things that didn't have the meaning to me, if that makes sense. And that's when I stopped looking.
Did you stop? You stopped looking? Did you stop responding to the invitations for a while, or did you continue to be dragged into the little, and then say, "Oh my God, what am I doing?"
Yeah, we've danced the same dance, you can tell. So it's too funny. For the most part, I would just respond negatively. And then another chair job came up where the head of the search committee calls me, right? And he is like, we really want you to put your name in, this whole thing. It was a place that my husband really would have liked to have lived. So, you kind of bring in the family side. And I was like, okay, I will send my CV. I wasn't really, I didn't, part of it was honestly a marital thing. And I will never forget after sending my CV in, after these people, this person contacted me more than once, like did the dance.
Yeah, yeah.
I get this phone call and the guy is like, we're looking at your CV and we just can't really figure out what you are, which is really, first of all, if you didn't look me up beforehand, why in the world were you calling me? Yes, my CV is incredibly diverse in what I've written about. So I just got pissed off. My temper rose. And I literally said, you can't tell what I am. I said, well, I'm probably the candidate that has the most diverse set of experiences that you could find, have done and published them at the highest level. But if you want to have somebody that studied IL-12 their entire career, that is not me. Thank you very much. Goodbye. And hung up. So that was it.
Call you back.
It was just like, I have a JAMA paper on this. I've written a humanitarian guidelines for surgical response in the world. Yes, those are very different things. Yeah. But guess what? Those are all at a level of intellectual scholarship and everything that I can't help it. I don't like doing the same thing all the time.
So let me ask you this question. If you had got that chair, with the benefit of hindsight as to where you are now and your interests and what you've done, would you have been a good chair, do you think? Or would you have been unhappy anyway?
No, I think I would have been a good chair. I think, I'm the kind of person who I mean, if I say I'm going to do something, I'm going to do it. I'm going to do it. I'm going to do it to the best of my capability. And to me, that's what you committed to, and you've got to deliver. You don't really have. It's not fair to take a job and not really give it your best. Now, I think the more interesting question is, if you did it and you did it and you felt like you had discharged your responsibilities, maybe the job would have been better and you're pleasantly surprised. But if it's not, I think it would be, I hope that I would have been smart enough to stop doing it if I didn't really enjoy it. And I think knowing myself, it's interesting. I had to get myself a no coach in my career, because I am somebody who will say yes, and then you just get, and I had to learn the strategic yeses, because I do commit, and then you're just, and I think having gone through sort of that hard work of learning to identify and be honest and what's important to me, what's not, I think if I didn't like it, I would have moved to something else.
Yeah. Well, you were clearly on a journey of as many people are, that has taken you in a slightly different direction. Your interest in global surgery, let's call it that, was that always there, or did it develop subsequently? I mean, south side of Chicago is not especially global. A lot of Irish there, of course, but
Especially when you go to Catholic school, including Jesuit medical school, John. You only go to Irish, Italian, and Polish weddings, because that's what it is.
where did the global interest come from, and where is it going for you?
Yeah, I mean, I guess it's always been very important to me to serve. Service is important. Service to something, that's not yourself.
Yep.
And even in medicine, I've always chosen to want to work in safety net hospitals, because I never wanted to ask a patient if they could afford me.
Yeah.
And I really do believe that if you don't have the same resources as somebody with a lot more wealth, that you still deserve excellent care. So I would say that's always been an incredibly, that's a hardcore value that is just part of me. And when I knew that I was going to be professor at Stanford, which is a difficult bar to pass.
Yes.
And it was like in some ways, it's the most freeing time in your life, because all of a sudden you're never going to have to be judged again. You're never going to have to put that paperwork in. You're never going to have to go in front of those committees and they weigh your contributions and all those kinds of things. So I decided at that time that it's interesting. It's also been academically the most productive time, because I decided I could take risk on.
Yeah.
Because, when you're trying to meet your promotion metrics, risk can be very dangerous, because, you have to get the right, the papers and everything. So at the same time, I decided that I was going to learn robotic surgery. So I was one of the early general surgery adopters. So this is like 2005, 2006. Mm-hmm. And I decided that I was at a point in time in my life that I wanted to give back in some way. The first thing I tried was to convince the DoD, that I would volunteer to go to Iraq or Afghanistan for like a month or so and work so they could send one of the surgeons home. Like, I would volunteer to take their place. I think a lot of people thought I was on some sort of weird drug or something, because I didn't want to join the military. I wanted to volunteer to do that. And I would get up to a certain level, and then it would be like, well, what happens if you're dead? I'm like, well, it's paperwork. I'll sign something. I'm not gonna sue you. I'm not gonna expect any benefits. So that became very obvious that that was going to go nowhere.
Yeah.
Even though in like World War II and things, you had these academic units and things like that. So I then decided that I wanted to work as a surgeon because I've spent this whole career, I have a lot of skills, and like it would be silly for me to go like pass out vaccines, right? What do? You're a highly skilled person. And it's actually very hard to work overseas as a surgeon if you're not very, very religious.
Yeah.
So,
Or-
yeah, if you're a missionary surgeon, there's lots of different opportunities. I am not very religious. I always say Catholic school will beat it out of you. No.
Yeah. Your internal voice, but it is true.
Yes, but I had a great education. But so then you start looking at ways that you can serve, and there aren't many. And to serve, I really wanted to serve in more like crisis humanitarian. So I went and interviewed with Doctors Without Borders, Médecins Sans Frontières.
Hmm?
And I actually speak French well enough. And most of the conflicts in Africa were in Francophone countries. I always joke like that the process to be interviewed and go through all that, we don't necessarily put some of our faculty through that. And they fairly rapidly called me and they said, hey, you want to go and work. And so I would save up all my vacation. And it was quite a discussion with my husband because, you're working in conflict zones.
Yes.
And
Using your vacation.
yeah, using my vacation. But it was a really interesting way to start in global health
Sure.
because you're seeing a population, you're seeing the health needs of a population, you're seeing the needs of a population that are under an incredible amount of stress because of conflict. And in many ways, the people who, people who can tend to leave areas of conflict. So it was like a pretty in-depth look at, disease systems, everything, what would it look like? And I provided direct patient care, right? And I joke I've been everything from a dentist to a neurosurgeon because, I would be the only surgeon there many times. But you can't take the academic out. And I started realizing all sorts of things. One, that modern surgery training did not train people for this. I don't know about you, but I did orthopedic rotation. I did a plastics rotation. I did a urology rotation. Our trainees don't do this anymore.
Yep.
So one of the easiest things I ever did, it was a lot of work, but like compared to other things I've tried to do, I designed and ran an international humanitarian aid surgery course for many years, I think I've trained close to 800 people over the years and hands-on how to do these things. Like, it was like, okay, I'm a general surgeon. Do you know how to hand cut a skin graft? Do you know how to put in a tibial traction pin? All of these kinds of, do you know how to do a C-section? Because the most common operation you're going to do. How do you get out an impacted head after 3 days of labor? All those things. So I designed that course. And then what I really started looking at is, how is it that we have a system that we're going to fly somebody from California? It's always 3 days to get someplace for me.
Yeah.
Why don't we have the capacity, like, if we have a problem here, we don't call Germany and be like, hey, Germany, send us some doctors, some surgeons. So how do we address the problem, which is we need to build capacity within these areas that there would be local surgeons to take care of that. That is a much harder problem. So that's sort of the inception. So I worked for years giving, doing aid, but then started trying to transition to how do you help solve the problem?
Yeah, it's the giving somebody fish rather than teaching them how to fish.
Yeah.
I interviewed a classmate of mine, actually, Vivian McAllister, um, has lived in Canada for many years. He was a liver transplant surgeon, and he was teaching what he refers to as catastrophe abdomen. And he was teaching it to the army, the Canadian military. Long story short, he ended up spending a huge amount of time in Kandahar, joined the army. He's a contemporary of mine, but as you'll hear on the interview with him, if you listen to it, he had on his desktop, on his laptop, a talk which when I was talking to him, I saw, and I said, this talk I have to hear, and it was called "Do-It-Yourself Neurosurgery," because the only two surgeons that were there in Kandahar were himself and an orthopedic surgeon. And so they had to teach themselves how to do basic neurosurgery. But he went because when he was teaching catastrophe abdomen, he thought to himself, why are we sending the young surgeons there? It should be people like me that are there, towards the end of their career or whatever. So where did you go to first in your MSF career?
Yeah, my first place was Côte d'Ivoire during one of their first civil insurrections. So had to cross the demilitarized zone to get up to the rebel controlled area of the country. And yeah, that was my first.
And I was going to ask you, when you said, when you received your professorship in Stanford, it was a bar, cleared, etc. It took a lot of stress. Did you view that as validation for you that the path you had taken was actually the right path rather than the traditional chair path?
No, never thought about it in that way.
And how did Stanford view about you disappearing off to a war zone, to, albeit on vacation? I mean, or did they pay attention or not?
Oh yeah. I mean, of course, it's sexy, right? Oh, we have this surgeon, they do this, and it's I would say that they've been very supportive. Um, you get some, yeah, I moved my class. I started my class at the college and then moved it to Stanford, I think like 2013 or something, because one, I could do it better.
Yep.
Because at the college, it's always so time compressed and you can't do it like a day and a half. Where here, and then I had this great partner that I found in OBGYN, because you do so I spent like a month in Congo once and did something like 73 C-sections, right? So you do so much OB. And in the States, because of, all the malpractice and stuff like that, it's not like you're going to be like, hey, can I just go scrub an OB case, right? You'd have to get malpractice insurance. I mean, I tried to actually do that before going to prepare. And the malpractice thing is just outrageous. So, no, I think that Stanford has always been very supportive of actually not just that part, but then all the other things that I've ended up doing.
Global, again, forgive me for using the term, but global surgery, if you like, outreach surgery, it is done more now, but it's still done very little. Back in the day, you would never meet people outside of missionaries, as you say. Do you think we as a surgical society, the small s, should do more to make it genuinely viable, genuinely attractive to people, or does it take a special type of person with their own inbuilt passion?
Well, my whole goal when I transitioned from doing, I mean, so to me, there's me being a humanitarian surgery, but if I'm going to help build capacity, my whole goal is I do not want to be doing surgery overseas unless it's knowledge transfer.
Well,
So you are getting people to independence and developing systems and capacity for them to expand their surgeons, expand their repertoire, or whatever. To me, those are vastly different things. So do I think that we should have more short-term missions going out? No. I think that, and I'm happy to say that, I've really seen much more of the investment side, especially from universities, being in helping try to educate, help with, all sorts of things. But that's the piece that I want to work with, not the trips.
and it's kind of a segue into the question I was going to ask you, and maybe you partially answered it. If there was one thing that you would like to change to make it better, what would that be? You've mentioned that there is more investment, but if you were in charge of the world for a brief period, what would you do to say, this is what we really need to do?
I think what I would want to do is have, what I really wish we could do is get to, it kind of comes back to why I wanted to be a chair. Like, I wish that we could say that surgical care, and we could argue about what the details of a package of surgical care would be, should be available to all members of a population. I really do believe that we should have some type of universal health coverage for the population that would involve surgical care. Now, does everybody need, plastic surgery? Of course not.
Sure.
Yeah. But, cosmetic plastic surgery, no. And I think always the devil's been in the details as to what does that package of surgical care really look like. And to achieve that, we have to have the resources to train people and to have jobs for them when they exit, that they can provide for their families and want to stay in the region where they are trained.
It's interesting, the NHS single payer system, everybody understands that from a political perspective, the statement tends to be universal health care, regardless of the ability to pay, free at the point of delivery. But it's always been to a limit, as in not every procedure is available. It hasn't been for decades. And there's been for example, as you say, purely aesthetic surgery tends not to be available on the NHS, etc. I've always felt, I spent 20 years in the NHS, and that's perfectly reasonable.
Yeah. I mean, if you want to have, cosmetic, I don't know why anybody on their face of the planet would want a Brazilian butt surgery, but clearly people want such a thing. You should pay cash for it.
Exactly. So, pivoting a little bit, not that you're proposing to disappear any moment now, how would you like overall to be remembered, and how do you think you will be remembered? It's a question I have asked people more than once before.
Yeah, it's an interesting time. My 40th graduation from medical school is next year. Many of my friends from college and other things who've been in medicine are always of my close friends from medical school, etc. I'm the only one still working.
Yep.
And how do I want to be remembered? I want to be remembered as somebody who touched people's lives, whether it be through my clinical practice, my mentorship of them, my inspiring them to be the best that they can be. I love getting emails from some medical student that you have no idea who they were and they became a psychiatrist and it's 8 years later and they're just out of the blue sending you something that's like, I wanted to say thank you. So to me, being remembered for the intangibles of how you elevated patients and people around you and touched their lives. And, it's, I kind of think back to the people who've touched my life and the fondness and what you feel that you really, what did you learn from that person? How you feel that person, changed you, influenced you, made you for the better. That to me is, yeah, that's what I want to be. I just got this thing from our program director because they sent me, they give some end of the year teaching award, and a number of the residents had written in comments about me and everything. And when I read those, because I am not there's rounds named after me because I still do teaching rounds. They're called Wren rounds. It is like I am not. I don't know what it is about me. I can make people cry by just looking at them, as far as I can tell.
It's a good thing.
I'm not sure. But when you read again how, and these are a totally different generation, how they see my interactions with them and what they're taking away, like getting those lines like sent to me really just made me really happy.
Yeah. One of my very earliest bosses said to me that, unless you're a genius, and as he said, there's nobody called Mozart in this room today, the only people that remember you are your patients and your students.
Yeah. And I think he was actually right.
Yeah.
Don't you love when you get the random email from your patient? Like, I have this patient who I did a total gastrectomy on, it's a horrible thing. This person, unfortunately, will not be long on this earth. And they'd really wanted to get back to horseback riding. And to have a picture of, somebody that you've been on this journey with, and they're achieving this thing that was just so important to them is just so meaningful.
Sure. Yeah. It's what matters to people is different from person to person, etc. Well, so in the few minutes that are left to us, I'm going to pivot to some slightly less profound, if not more important, questions for you.
Let's get to the fun, like what we do for fun.
So, it's a segue into question number one. What is your ideal dream weekend?
Oh, weekend?
Yeah.
Okay. My ideal dream weekend is to enjoy a great meal with my husband and some friends and to be with my dogs.
Okay.
And have some time to relax and read a book.
It's as though you've read the script. So what book is on your nightstand at present?
I only read two genres. I read history or science fiction fantasy. And I sometimes alternate, like I'll read a sci-fi book or fantasy book, and then I'll go to a history book. I was just reading this history book, and it was so depressing. It was a story. I've worked in the area. It's about a place in Africa, and I literally just had to stop reading it. It was upsetting me too much. And I'm like, okay, I'm gonna go do some fantasy right now. So I picked up an old Michael Crichton book from when it was like one of his earlier books where it was too funny, a young doctor, and it was just so, yeah, I went to that because I just needed to get away from this book that it was too much.
So, you're going out with your husband for what's your favorite food?
Good food.
Doesn't matter.
I mean, we like to walk.
Okay.
So we live, we walk. So we have how if you keep going to a same restaurant, they get to know you, you get to know them. So we like to go out. We have a French bistro near us, and we just walk over. We'll take the dogs a lot of times. They know us, so they give us, a great table I have 3 dogs. And they're very good restaurant dogs.
Oh, yeah.
Yeah, they don't bark at other dogs going by. And when you have bull terriers, they're unique looking.
Yes, they are. Yeah.
Yes. And we just go, we have a nice meal, and like sometimes another friend will come along, or we go to a friend. Like last weekend, we went to a friend's house for dinner there with her dog. So it's just the weekends are, if I can, I like to just try to decompress a bit from the week.
What's your favorite movie?
I don't know, my favorite movie. I love watching movies, and since I fly a lot, I try to find good movies on the airplane. I don't know. I don't think the funny thing is, I don't think I have a favorite movie. I like to revisit movies to see that you had good memories of, to see if they stand up. So it's really funny because some movies don't take the test of time.
Have you watched, is there a movie that you've watched between 5 and 10 times?
Okay, it's going to sound really crazy. I love the movie Mame.
It's not crazy. It's a little unusual, that's for sure.
But not the one with Lucille Ball. Yeah. I mean, and I'll never forget, what do you want to do? I want to live, live, live.
Now, in this country, they call it vacation, but on the other side of the Atlantic, they call it a holiday.
Oh, yes.
What is your holiday heaven and what is your holiday hell?
My holiday heaven is to live on a dive boat for at least 10 days. And when you live on a dive boat, they're about, a 100-foot boat. They're not big. You've got somewhere 12 to 20 people max. And you eat, sleep, dive, read, and talk to other interesting people who are on this boat. And I spend something between 4 to 6 hours a day in the water seeing diving. That is absolute heaven. And the most common place that I do that is Indonesia.
And most of those people, as you would you're same as your response to them. They don't care that you're a famous surgeon, and same as you don't care what they do. It's interesting. It's a conversation piece, but
Actually, though, I have a reputation. There's a person who you end up meeting people, and you meet these organizers. So you end up kind of diving with groups of people that you've sort of met. You make dive friends. It's sort of interesting. So I'm called Warzone Woman because if I am the person, and it happens more often than you would think, I am the person who always will save your ass. If there's an emergency, I am
Right.
I'm war zone woman, and it is crazy. I can't tell you how many times I've had to do this, but also when I fly, I don't know what it is. I have sort of this curse that I get medical emergencies.
So what about holiday hell?
Holiday hell for me would be being stuck, on a beach or something like holiday hell for me is what most people do on their vacation. Like I would love, like, like we organized a trip, took a bunch of friends, we all went to Sicily, and it was great. We went and saw interesting art things, we went to this, that, but just sitting around at a resort is holiday hell for me. I can't, it works for some people, but that to me, I would just go crazy.
Can't imagine that you would be a big fan of a Disney cruise.
No, no.
The last
No, resort, like people, I don't, I guess people love it. I love to do adventuresome things on vacation. I want to be doing things, seeing things, meeting new people. The thought of staying in a resort, yeah.
people do, they find it very relaxing. Last question I'm going to ask you is, what advice would you give the 26-year-old Sherry?
I think the advice I would have given the 26-year-old Sherry was to figure out what demons drive you. Because once you figure out what demons drive you, they lose their power to drive you.
Yeah.
And then you're in control, and to learn how to be honest, to be willing to be honest with yourself. Because being honest with yourself sometimes means you might be not displeasing, but disappointing other people who may have thought different things or wanted other things for you. But find your demon.
Find your demons. That's a good phrase to finish on. I want to thank you again, Sherry, for spending some of your time with me today. It's been very enjoyable, different. Each one is different. That's the whole idea.
Well, thank you so much for asking me. I was sort of honored. I'm like, okay.
I don't know about that, but I'm delighted you did it, and I'm very grateful you took the time. Thank you so much.